Hi everybody, and welcome back to a very special episode of For the Health of It. I'm Dr. James Morgan, and today we're going to be doing a little Q&A. These are some of the top questions that I got via social media, an email. If you're on my mailing list and you answered the survey, these are some of the top questions that I got. So number one, why do some people get aches and pains when it gets cold and when there's a change in the weather? Well, it's kind of funny because it's almost as if like a dog can sense when an earthquake's going to come. Of course, for those of you that live in California and for those of you that have dogs might understand that. Anywhere else in the country, look it up. But it's very similar. A lot of times we as humans will be able to feel and sense when there's going to be a change in the weather. Number one of the reasons why is when it gets cold, there's constriction, vascular constriction. And what I mean by that, best example is for those of you that have a lot of noticeable veins, when it gets cold, those veins kind of disappear. However, when it gets hot outside or when you're physically active, those veins will pop out, which means those veins are dilating, or the vasculature is dilating. Cold is constriction. And if there's constricted vasculature, that can exacerbate or enhance previous injuries or wear and tear on your body that you may have endured previously. At the same time, the barometric pressure, basically meaning when the air gets thicker or heavier, that can help give us a sense of there's going to be cold, rainy weather ahead, and that just exacerbates previous injuries that we may have had. So usually a lot of times those that are physically active and they're new to being physically active, basically a lot of our kids, they won't necessarily be able to feel the change in weather, but at the same time, for those of us that spend a little time out in the world, you might be able to feel the difference. Okay, question number two. What are the signs and symptoms of vitamin D deficiency and what do you do with them? Well, signs and symptoms of vitamin D deficiency are usually pretty subtle. Aches and pains, weakness, even without cold weather, and sometimes fatigue. A lot of times we'll see these in patients that have strict vegan diets, have a limited sun exposure, GI issues such as Crohn's disease or celiac disease, and those with kidney disorders. So kind of what to do with it. A lot of times you can just get your vitamin D up by some of the foods that you eat. Getting fortified dairy, whole grain, fish or egg yolks. Another thing you can do is get more sunlight. It's something that for some reason the sun and I don't get along very well. So a lot of times I'll have to get my vitamin D from the foods that I eat. Of course, if it's something that you're really concerned about, go see your medical provider. A lot of times it's just a simple blood test and those results can show if you're deficient or not. And a lot of times as providers we'll just say, hey, try to get some vitamin D into your daily diet, get a little bit of sun and you'll be okay. But for those of you that might be decreased in your vitamin D, sometimes there'll be supplements that we can add. Very simple to do, but it's very important to get your vitamin D checked, especially you ladies out there, because vitamin D helps calcium in the bones. So if you have a decrease in your vitamin D, you have a decrease in your calcium, which then softens your bones, and women already are more prone to arthritis and osteoporosis. So it's something very important to get checked out. Okay, and question number three for today is, what are some cold treatments for children? So common cold treatments for children. First, let's talk about some symptoms. You get the runny, stuffy nose, maybe a fever, cough, body aches, feeling of being tired. Those are some of the most common cold symptoms in children. But however, I get so many parents coming in, we need an antibiotic. Well, no, you don't always need an antibiotic, and I'm not going to go into all that detail. Make sure you check out the other episode of For the Health of It when I talk about antibiotics. But what to do? Symptomatic care. Okay? Symptomatic care meaning rest. Increase your fluids. If there's fatigue or body aches or fever, you can do some over-the-counter medication. But let's make sure it's clear that a lot of over-the-counter medications are not good for children under 4. So don't be in a common practice of using over-the-counter medications for children younger than 4 unless advised to do so by your medical provider. But the number one way to prevent from getting sick and from also spreading any type of disease is washing your hands. The number one way, folks, getting warm, hot water and getting a nice soapy lather, making sure you get all over the hands. not only for you, but also getting that to good practice for your children. So how long do we wash our hands for? At least 20 seconds, or singing happy birthday twice. And that's it for today of our first Q&A. If you have questions that you would like to have answered on an upcoming episode of For the Health of It, make sure you reach out to me on any of the social media platforms. Check out the website, join the mailing list. Those are the questions that you have. Those are the questions that I answer. So make sure you check it out for the next episode, For the Health of It. See you next time.